Tonight, before you go to sleep, I want you to do one thing you have never done before. Take one small bottle of oil, an oil that has been used medicinally across the Middle East, North Africa, and South Asia for over 2,000 years, and rub it into your lower back and along your sciatic nerve pathway for 2 minutes. Then go to sleep. And tomorrow morning, when you swing your legs off the bed and stand up, pay close attention to what you feel, because something is going to be different. Not because this oil works like a painkiller, not because it numbs the nerve temporarily, but because its primary active compound, a molecule called thymoquinone, penetrates through the skin, reaches the inflamed sciatic nerve tissue beneath, and does something to the inflammatory environment around your nerve that most topical products never achieve. Tonight, I am telling you exactly what that oil is, exactly what thymoquinone does to your sciatic nerve while you sleep, and exactly how to apply it correctly starting tonight. And real quick, if someone you know has been applying topical products to their sciatica without getting lasting results, pause right now and send this video to them. What they are about to hear explains exactly why most topical approaches fail, and what this specific oil does differently. And if you are not subscribed yet, hit that subscribe button right now. Every week, this channel brings you natural solutions that actually reach the problem. Now let us get completely into this. My name is Dr. Michael Kent, and in 20 years of senior health practice, one of the most consistent frustrations I hear from sciatica patients is about topical products. They apply them. They feel temporary surface relief. And an hour later, the deep burning pain is back exactly where it was. Tonight, I am going to explain exactly why that happens, and exactly why black seed oil breaks that pattern completely. But first, let me share a story. All details have been changed to protect privacy. A patient came to me, a senior in their late 60s, who had been managing right-sided sciatica for approximately 19 months. Their supplement protocol was comprehensive. Their stretching routine was consistent. Their diet was genuinely anti-inflammatory. And yet every single morning they woke up with the same burning sensation running from their lower back through their right buttock and down the back of their leg. They had tried 3 different topical products, a cooling menthol gel, a heating capsaicin cream, and a mag. Each one provided between 30 minutes and 2 hours of partial surface relief. None of them changed what the nerve felt like the next morning. During our consultation, I asked one question that changed the direction of their recovery. Have you ever tried black seed oil topically? They looked at me the way most patients look at me when I mention something they have never heard of in the context of sciatica. Blank, slow, slightly skeptical. I explained what thymoquinone does when it penetrates the skin. I explained why black seed oil reaches the nerve tissue in a way that menthol and capsaicin creams cannot. And I gave them a specific application protocol to follow every night before bed. Now here is where it gets really interesting. Stay with me, because what happened next is the part that makes this oil genuinely different from everything else in the topical category. They came back 4 weeks later. They sat down. They paused the way patients pause when something has genuinely surprised them. And then they said, "The morning pain is different. Not gone, but different. Less deep, less burning. Deep. Like something is actually reaching the nerve instead of just sitting on top of my skin." That description, and something actually reaching the nerve, is exactly what thymoquinone does. And tonight I'm explaining precisely how. Here is what most people never understand about topical treatments for sciatica. And this is the piece that explains why most of them consistently disappoint. Your sciatic nerve does not sit near the surface of your skin. It runs deep, through layers of skin, subcutaneous fat, fascia, and muscle tissue, before reaching the nerve pathway where the pain originates. Most topical compounds, menthol, lidocaine, standard diclofenac gel, have limited skin penetration depth. They reach the superficial nerve endings in the upper skin layers. They create a competing sensation or a surface anti-inflammatory effect, but they do not penetrate deeply enough to reach the actual inflamed sciatic nerve tissue several centimeters beneath the skin surface. This is why they provide surface relief that fades, because the source of the pain is not where the compound is reaching. Thymoquinone from black seed oil is fundamentally different, and here is exactly why. Thymoquinone is a small lipophilic molecule, meaning it is fat-soluble and has high affinity for the phospholipid bilayers of cell membranes. Research published in the journal Drug Delivery found that thymoquinone demonstrated significantly higher transdermal penetration rates than most common topical analgesic compounds, penetrating through multiple tissue layers to reach concentrations in deep tissue that surface-acting topical products cannot achieve. The researchers specifically attributed this penetration capability to thymoquinone's lipophilic molecular structure and its small molecular weight, properties that allow it to pass through the lipid-rich membranes of skin cells, fat cells, and fascial tissue with minimal resistance. This means that when you apply black seed oil along the sciatic nerve pathway before bed and allow it to absorb during the overnight hours when you are horizontal and your tissue circulation has shifted to its overnight pattern, thymoquinone is actively penetrating toward the nerve tissue rather than sitting on the skin surface. By the time you wake up, it has reached concentrations in the deeper tissue layers surrounding the sciatic nerve that no menthol gel and no standard topical compound achieves from a single application. Now here's the second thing thymoquinone does, and this is the part that nobody else explains. Once thymoquinone reaches the inflamed sciatic nerve tissue, it does not just sit there. It actively inhibits 3 specific inflammatory pathways simultaneously. And this triple inhibition is what produces the qualitatively different overnight relief that the patient in our story described as something actually reaching the nerve. The first pathway is NF-κB inhibition. NF-κB is the master inflammatory switch controlling the production of TNF-alpha, interleukin-1 beta, and COX-2 in nerve tissue. Research published in the journal Inflammation Research found that thymoquinone produced potent NF-κB inhibition in peripheral nerve tissue models, directly reducing the production of every major pro-inflammatory cytokine maintaining sciatic nerve hypersensitivity. This NF-κB inhibition is the primary mechanism through which black seed oil produces lasting overnight anti-inflammatory effects rather than temporary surface relief. The second pathway is COX-2 enzyme inhibition, the same pathway targeted by pharmaceutical anti-inflammatory medicines, but achieved through a natural mechanism without the gastrointestinal and cardiovascular risks associated with long-term pharmaceutical COX-2 inhibitor use. Research published in the Journal of Ethnopharmacology confirmed that thymoquinone produced significant and dose-dependent COX-2 inhibition, reducing prostaglandin E2 production in inflammatory tissue with potency comparable to pharmaceutical anti-inflammatory compounds at therapeutic concentrations. Now stay with me, because the third pathway is the one that makes thymoquinone genuinely unique among all natural topical compounds. Thymoquinone also directly activates TRPV1 receptors on sciatic nerve endings, the same receptors that capsaicin activates, but through a different and more sustainable mechanism. While capsaicin produces intense initial TRPV1 activation that burns intensely before substance P depletion occurs, thymoquinone produces a gentler and more sustained TRPV1 modulation that reduces nerve hypersensitivity without the intense burning phase that most capsaicin users find so difficult to tolerate. Research published in the European Journal of Pharmacology found that thymoquinone-mediated TRPV1 modulation produced significant reductions in peripheral nerve pain behavior in inflammatory pain models, with none of the acute irritation associated with direct capsaicin application. This makes black seed oil the only natural topical that provides substance P pathway pain reduction alongside NF-κB and COX-2 inhibition. 3 simultaneous mechanisms from a single overnight application. 3 pathways: NF-κB inhibition, COX-2 suppression, TRPV1 modulation, all activated by thymoquinone penetrating to the sciatic nerve tissue during the overnight hours. This is why the patient in our story described the morning pain as qualitatively different rather than just quantitatively less. The nerve's inflammatory environment had genuinely changed, not just been temporarily masked. Here is exactly how to apply black seed oil correctly for maximum sciatic nerve benefit. Purchase cold-pressed black seed oil, also called black cumin seed oil or Nigella sativa oil, in a dark glass bottle. Cold pressing preserves the thymoquinone content that heat extraction degrades. Quality brands available at Whole Foods, Amazon, and health food retailers across America include Amazing Herbs Black Seed Oil, Kiva Black Seed Oil, and Joe Nutrition Black Seed Oil, all cold pressed with third-party testing for thymoquinone content. Look for products specifying minimum 1.5% thymoquinone content on the label. This is the therapeutic concentration confirmed in penetration research. Every single night, 30 minutes before going to sleep, pour approximately 1 teaspoon of black seed oil into your palm. Apply it along the complete sciatic nerve pathway on your affected side, starting at the sacroiliac joint in your lower back, across the piriformis region of the buttock, down the posterior thigh to the back of the knee. Massage firmly using slow, deep circular movements for 2 full minutes. The massage pressure serves 3 critical purposes. It drives the oil deeper into the tissue layers through mechanical pressure. It increases local blood flow that enhances thymoquinone absorption, and it directly stimulates the mechanoreceptors in the sciatic nerve pathway that activate gait control pain reduction. After massaging, cover the treated area with a thin cotton layer, a pair of loose cotton pajamas, or a light cotton sheet to prevent the oil from transferring to bedding and to maintain skin contact throughout the overnight absorption period. To significantly amplify the penetration depth of thymoquinone, add 5 drops of dimethyl sulfoxide, DMSO, to your teaspoon of black seed oil before application. DMSO is a natural compound derived from wood pulp that has been shown in pharmaceutical research to dramatically enhance the transdermal penetration of therapeutic compounds applied alongside it. And increasing the depth of tissue penetration by up to 300% compared to oil applied without DMSO. Available at health food stores and Amazon. Ensure pharmaceutical-grade DMSO and apply the mixture immediately after combining, as DMSO begins evaporating quickly after exposure to air. Alternatively, if DMSO is not accessible, warm the black seed oil slightly before application. Place the teaspoon of oil in a small dish and set it in warm water for 2 minutes before applying. Slightly warmed oil, approximately 38 to 40 degrees Celsius, has measurably higher skin penetration rates than room temperature oil due to the temperature-dependent increase in skin membrane permeability. This simple warming step requires 30 seconds and meaningfully improves the depth of the thymoquinone penetration without any additional ingredient. Apply every single night without exception. The anti-inflammatory effects of thymoquinone accumulate with consistent nightly application, each application building on the previous night's tissue concentration. Most patients report the first meaningful change in morning pain character between nights 5 and 10. The full benefit, and including the sustained reduction in sciatic nerve inflammatory baseline that produces lasting rather than temporary improvement, develops over 4 to 6 weeks of consistent nightly use. The patient from our story has applied black seed oil every single night for 7 months. Their morning pain score, which had plateaued at 5 to 6 despite comprehensive supplement and exercise protocols, now averages 2 to 3. They describe the change as the first time a topical product actually changed the morning rather than just making the evening more comfortable. They keep the dark glass bottle on their bedside table where it is the last thing they reach for before turning off the light. 2 minutes of application, every night, 7 months of progressive improvement. In 20 years of practice, the topical intervention for sciatica that produces the most consistent and most qualitatively meaningful results, particularly for patients who have already tried standard topical products without lasting benefit, is black seed oil applied correctly along the complete nerve pathway before sleep. Not because of one mechanism, because of 3: NF-κB inhibition, COX-2 suppression, TRPV1 modulation, all from thymoquinone reaching the nerve that standard topicals never touch. Tonight, the bottle is available. The application takes 2 minutes. And your sciatic nerve's overnight inflammatory environment is about to meet something that can genuinely change it. Now, before you go, drop a comment right now and tell me your age and your city. And tell me, have you ever tried black seed oil for anything before? Have you ever applied it topically along your sciatic nerve? I read every single comment personally. And if this video gave you something genuinely new, a topical intervention that reaches deeper than anything you have tried before, share it right now with someone whose sciatica has never responded to topical treatments. Subscribe and turn on notifications because every week this channel brings you something equally specific and equally practical. 1 teaspoon along the nerve pathway every night before bed, starting tonight. This video is for educational purposes only and is not medical advice. All patient stories have been changed to protect privacy. Individual results vary. Black seed oil may cause skin irritation in sensitive individuals. Perform a patch test before full application. DMSO should only be used pharmaceutical grade and applied to clean skin. It enhances penetration of all compounds, including contaminants. Black seed oil may interact with blood-thinning medications. Always consult your healthcare provider before starting any new topical protocol. Dr. Michael Kent is a senior health educator with 20 years of experience in senior wellness. Nothing here is intended to diagnose, treat, cure, or prevent any condition. Viewer discretion advised.